UK Prime Minister Boris Johnson has today announced that he has tested positive for the novel coronavirus. Johnson, who's 55, has been self-isolating for the last 24 hours in number 10 Downing Street, which is the Prime Minister's current home. On Twitter, he announced that he was displaying mild symptoms and is currently following the national health guidelines which the government set out around 2 weeks ago. Johnson is the second high-profile case in the UK. Prince Charles, heir to the throne, who's 71 years old, also tested positive and was showing mild symptoms. Why is this important? Well, the UK has over 11,000 cases and nearing 600 deaths, and those figures are going to rise, as experts are suggesting. It paints a few questions to Boris Johnson's case. Why and how did Boris Johnson get infected? Who did he have contact with who may have been showing symptoms or was symptomless? Secondly, it does ask the question, should the UK be testing more to identify the accurate number of cases? Surely, with Mr. Johnson and Prince Charles both becoming infected with novel coronavirus, that perhaps the cases of coronavirus are more widespread than the statistics are showing in the UK. As we're seeing in Europe, which has now become the epicenter of the outbreak, we're looking at Italy and Spain, who are having constantly rising figures of death toll. Of course, Italy has seen a reduction in the number of new infections, which is hoping that their own strategy is working.